In this video, we will walk through the proper way to safely administer an IV drip or long infusion of a chemotherapy drug. Examples of chemotherapy drugs that are given as an IV drip are listed here. First, gather all the supplies needed for chemotherapy administration. Some of these items were sent previously by VOP, including the bags of personal protective equipment, saline flush and administration supplies pictured here, and the chemotherapy drug itself, which was stored in your hospital's refrigerator when the shipment first arrived. You will also need a 3 ml saline flush syringe, which should be readily available within your hospital. You are now ready to don your personal protective equipment. All team members that will be participating in the chemotherapy administration need to put on a provided chemotherapy mask, gown, and nitrile gloves. Each team member will need to double glove prior to chemotherapy administration. Safety goggles or a face shield are also recommended but not provided by VOP. It is important that the sleeves of the gown extend to cover the end of the gloves and any exposed skin. Now it's time to place your patient's IV catheter. We strongly recommend watching the VOP training video on proper IV catheter placement for chemotherapy administration. Once the catheter is in place, you will need to remove the chemotherapy dose from the chemotherapy transport bag and confirm with the doctor that the patient label on the drug matches the drug name and dose listed in the VOP consult. A copy of this consult was included in your patient document sleeve shipped with this dose, as well as sent via email to your hospital. Give any pre-medications if needed. VOP provides and recommends administering diphenhydramine intramuscularly for adriamycin and mitoxantrone infusions. You may also need to give sedation prior to chemotherapy, as it is very important that these patients remain still and calm throughout the entire chemotherapy administration. If the IV catheter was not placed immediately prior to chemotherapy administration, then we recommend that placement be confirmed one more time. The IV catheter must bleed back with ease. If the catheter is occluded or vein is blown, replace it with a new catheter into a different leg. Flush your catheter by attaching your saline flush to the T-connector's blue clave. Pull back on the plunger of the syringe until blood is noted in the line, confirming proper placement of the IV catheter. Then flush the line completely and clamp the line. We are now going to prepare the flush to be used during the chemotherapy drug administration. Locate the 10 cc flush syringe provided by VOP and remove the white cap. Attach the flush syringe to the EquiShield female Lure Lock connector and set aside. You are now ready to administer your patient's chemotherapy dose. Place the chemotherapy administration pad under the patient's limb. Hang the chemotherapy drug administration bag on a fluid pole or S-hook above the patient's head, being sure to allow sufficient length in the line. It is important to understand that the IV line has already been primed with saline and that the chemotherapy drug is contained within the bag. The line must remain clamped at all times unless connected to the patient. Next, attach the EquiShield Lure Lock adapter to the closest blue clave port to the patient. Then connect the end of the IV line to the blue clave port on the patient's T connector and firmly secure the Lure Lock attachment. Now unclamp the IV line and T connector and adjust the roll clamp to give the chemotherapy drug slowly over a 20-minute drip. This translates to about 1 to 2 drops per second, but can be adjusted as needed. You may not use an IV pump for delivery. It is essential that a team member wearing PPE sits with this patient constantly during the entire administration. The patient should never be left alone during a drip infusion. Check the patient's leg frequently during the administration to make sure the vein is still patent and that no swelling or irritation is noted. Once the IV chemotherapy drip is finished and the chemotherapy drug has made it to the Lure Lock adapter attached to the last port on the IV line, clamp the line above this port. It is common for the drug to not make it all the way to the final port as seen here, but try to get as close as possible and still clamp the line above the port prior to flushing. Once the line is clamped, remove the red cap from the 10 ml flush syringe and attach it to the EquiShield Lure Lock adapter. To connect the EquiShield components, line up the 3 vertical red lines on both adapters as seen in this image and press firmly together until the button clicks into place. Use the entire 10 ml flush syringe to flush through the adapter to clear the residual drug from the line and catheter between the adapter and the patient. Clamp the line at the T-port. Do not disconnect the IV line from the patient's T connector or remove the flush syringe. Instead, remove the IV catheter from the patient by cutting the tape on the lateral aspect of the limb away from the catheter itself. Place the entire connected IV line, bag, T connector, IV catheter, and flush syringe rolled inside the chemotherapy administration pad into the provided plastic chemotherapy transport bag. Seal completely. You may now reverse sedation if used. Finally, place the sealed chemotherapy transport bag, your gowns and gloves into the yellow chemotherapy disposal bag or bin for your hospital.